So again, my name is Norbert Goldfield, and I'm the founder and executive director of Ask Nurses and Doctors. Our mission is to organize healthcare professionals in support of either candidates or incumbents or healthcare legislation pertaining to healthcare reform. We've been in existence for 5 years, and we've worked on any number of races. And over the last few months, as we start to build up our networks of healthcare professionals in swing states and swing districts and healthcare professionals in general, what we're doing is having a monthly series of conversations between what I call seasoned activists and young activists. Bill Fletcher was on the call last month, and he made it very clear to me, and this was in the recording, so you can all hear it. He said, I want you to know that I just had a physical, Norbert, and I'm feeling very young. So I think it's important to make that distinction and make it clear we're talking about seasoned activists and young activists. So the format of today is similar to what we've done in the past. And this is our fourth, it's either our third or our fourth, and we'll have one a month. It is a conversation between our two participants, and they will introduce themselves. And we'll start with Austin Vaughn and then move on to Don Berwick. They will have a conversation. I would encourage you as much as possible, first of all, to think of any questions at all. All questions are good. These are very challenging times, and we want to utilize our social credibility as healthcare professionals, which is the premise behind Ask Nurses and Doctors, to make a difference in this election. And the reality is we know. I was on a call today, on a Zoom call with the pollster Celinda Lake, who many of you I'm sure have heard of, certainly one of the prime pollsters in the United States. And she attested to the fact that healthcare is a very important issue in this election. A combination of issues pertaining to abortion, but also the skyrocketing costs of healthcare, and so that nexus of challenges in healthcare and the cost of healthcare are extremely important. So without further ado, and I'll certainly get involved later, but I'd like to introduce Austin Vaughn. Like I said, this is one of the joys of doing this work, is you meet people that you never would have met before. And it's a pleasure to get to know you, Austin. And thanks so much for being on the call. And I'll let you take it away.
Alrighty. Well, the pleasure is mine. And thank you all for tuning in. And I'm just going to start with, for everybody in the Northeast who's tuned in, because I see some familiar Maine faces, I hope that all of you are warm and still have power. I do not have power at my home in Topsom, so I am down at a friend's place in Biddeford to make sure I had internet connection. So please forgive me for my not very inspiring or interesting Zoom background. But I am really excited to kind of be here today to speak about my experiences and hopefully be able to have a conversation and learn from the people on this call as well about just the ways that we can get involved and work together to try to push our country in a meaningful direction that's better for everyone, and most specifically some of our more underserved and underprivileged patients. So I'll give you just a brief history on myself. I grew up outside of Tampa, Florida, with a few siblings. My father was a political editor, so I think I was very fortunate in the fact that I grew up politically aware. I wouldn't necessarily say super advocacious as a child. I've seen 14 and 15-year-olds in the state house this year, and I would never thought about doing something like that at my age when I was back then. But certainly aware of the things going on and trying to kind of keep myself educated. When I got to my undergraduate college at Florida State, I worked for a couple of organizations that did some work out in some of the more poorer regions of Florida and the Panhandle, specifically the pediatric outreach program at Florida State University's College of Medicine. And I think that was kind of my first exposure to some of the disparities in care that I had never really been exposed to, and really kind of got my mind started thinking about ways that I could try to help fix those. After undergraduate school, after I graduated with a degree in exercise science and music, I actually went up to New Jersey for a few years, and I worked for a nonprofit muscular dystrophy association. I worked in clinics there, and was even further kind of exposed to just the pitfalls of our healthcare system and the way that, you know, our politicians and the policy that is written on both the state, local, and national level doesn't do anything to support these populations. A lot of times it actually really kind of continues to keep them in a place of lacking of resources. So eventually when I got to 2020, my now wife and I were feeling very angsty as I was back down in Florida going to grad school before going to medical school, and we ended up getting involved with a local politician down there. She ended up being his campaign manager. I was one of his lead campaign volunteers, and he ended up winning in arguably the most competitive district in Florida that year by about a percentage point. And then made my way up to medical school, and people told me I would probably need to take a back seat on some of the politics stuff in medical school. And that lasted all of about 5 minutes until I realized that it was actually the thing that was going to kind of drive me through medical school. I would not consider myself a note card and textbook type of person. I like to learn by doing. And so one of the ways that I kept myself kind of focused and engaged in the first few years of medical school is then to be engaged at a policy level, where I was able to meet some incredible people and work on some of the really great legislative efforts that have happened here in the state of Maine. I do feel very fortunate to be in the state of Maine, that it feels like a state that is very accessible to people wanting to share their comments and have conversations with local politicians. And so I've been involved with advocacy efforts on everything from reproductive health to gun safety to shield bills to creating access to more resources, pharmaceutical and otherwise, for rural areas. And I think that that specifically medicine has a really interesting, but also important place in political advocacy. I feel like my personal feeling is that it's an obligation of people that, you know, provide for patients to look at the things that are affecting their health outside of the exam room and think about ways that we can work to positively impact their health outcomes. And so, you know, being able to work alongside a lot of really great healthcare providers in trying to move the needle towards an area of equity and justice for traditionally marginalized communities has been something that's been very rewarding. And I think that as a medical student, I've been afforded a lot of opportunities, but also respect from people that I've been able to meet, about just because there aren't a lot of other medical students kind of getting up there to do that thing. And medical school is a pretty busy time. Norbert had said that Bill Fletcher said he felt young. I feel like I'm aging in reverse. So maybe I'm the seasoned one. But so I think that that making sure that your voice is not just there, but and present, but also is in a place where you feel you know, connected to, is really something that I'm very passionate about. And, you know, I'm looking forward to talking with all of you about, you know, the upcoming elections, and also maybe about, you know, ways that we can get some of the younger health professionals in our lives involved in some of the things that I feel like have worked for me and that I've tried with some of my colleagues and peers. And with that, I'm going to mute myself, and I will let Dr. Berwick take it away.
Thank you, Austin.
Thanks, Austin, and thank you, Norbert. I'm Don Berwick, a pediatrician by training. I founded the Institute for Healthcare Improvement, where I'm now a senior fellow, and I ran Medicare and Medicaid for President Obama for 2010 and 2011. And it's just a joy to be with you. It's oxygen to be with you, because I know, like most of you, I'm pretty worried. And get nothing like being together. Never worry alone, we say. It's also, I just have to say, seeing Steve Jenks and Mary Willie and Art Kellerman here also gives me enormous joy. We have a network of great people, and good to see you all. I'm going to spend a few minutes saying the obvious just because somebody's got to say it. This is the most consequential election of my life. I've said that in many elections. This time it feels more like it's true than any time before. The nation's at the brink. We have, as you know, a would-be president who would ignore the Constitution, seize the judicial system, disassemble orderly administration, and hurt many, many people. And I think threatens to end the compassionate potential of government as in a civilized nation. The stakes couldn't be higher. The lens I view that through is healthcare, like many of you. At any level, the threat is dire. At the level of healthcare itself, I got to be the first administrator to really implement the Affordable Care Act shortly after it was passed. Massive, massive progress, 22 or 23 million people covered, and all sorts of benefits that the public did not have, sort of a step toward universal, just healthcare in this country. And it could be reversed. We're seeing already, even in this administration, a constant wave toward privatization of healthcare, money taking over healthcare, and we need an administration and a Congress that will stop that. We see the honoring of misinformation instead of science, failures of preparedness, in endless profiteering, and we need an administration to stop that. I personally don't think you could stop the Affordable Care Act anymore, but you could do a lot of damage to this country. So if we're interested in protecting people with health care, we've got to work at it, because it's not going to go well if not. At the level of health, the social determinants of health, as we say, we actually have an administration that's shown probably more investment in that challenge than any in my memory. President Biden's accomplishments are not well understood, but cutting child poverty in half, really working finally at last on drug pricing. We don't know how that'll go, but we've started. In Senate and CMS, where Steve Jenks and I worked, I'm seeing much more fiber, much more willingness to begin to stand up on behalf of beneficiaries, to stop the profiteering, to push back on Medicare Advantage, which is basically looting the country right now. But that takes political courage and political support, and a sense of health in all policies. You can't speak to anybody in the Biden administration who won't talk about equity. It's the first sentence, the first word in the first sentence of any conversation I'm having there, and I think they mean it. At the larger picture, climate change, which is a health problem, we finally are trying to lead, or at least participate in an international level. It's we have an administration that's actually made progress. It will all be lost, all be reversed, if we don't win this election. In addition to the health care and health threats we're talking about, there's a deeper threat, and that I think is to the moral underpinnings of our society. I always saw the quote from Hubert Humphrey when I entered the Humphrey building, where CMS headquarters, where my office was. Humphrey said at the dedication of that HHS building that the moral test of government is how it cares for people at the dawn of life, children, people at the twilight of life, the aged, and people in the shadows of life, the sick, the needy, and the disabled. I deeply believe that, and we have got to pass that test, and we're flunking now due to a paralyzed Congress and a wing in our country that is willing to leave people damaged at the side of the road. I'm not. So this has got to change. Now, I didn't say anything you don't all know, but Norbert is challenging us to think about, okay, what do we do? My view is that the engagement of people, especially in medicine, in politics now, is one of the few chances we have. We physicians, nurses, pharmacists, therapists of all type, people who are involved in healthcare, we are trusted in this country still. You can read some of the negative stuff, but every single person in healthcare has a podium to speak out to communities and friends and neighbors and the press about the truth and the moral commitment to solidarity and to caring for people in poor circumstances. There's one other technicality here, which is you mentioned Celinda Lake. I saw a Gallup poll that perhaps Celinda also would know about, asking what are people thinking about healthcare in this country. It's very clear. They're worried about cost. There are 110 million Americans in medical debt. Bankruptcy is a threat to everybody of marginal income in this country, and people are really angry that they feel more and more money taken out of their pockets by the healthcare system. The second thing they worry about is access. I can't reach my doctor. I can't reach primary care. I can't get the help I need, or I'm worried I won't be able to. And the third is complexity. This whole thing is dark. I don't understand what's going on. We in the clinical world can go to the patients, go to the public and say, if you are worried about costs and your own security and access and financial security, and if it's too confusing for you to feel like you're getting a fair shake, then the only answer is to move forward with policies in this country that respect science, compassion, and public mechanisms to help get people the help they need. We have to draw that connection, and we can. I am thinking in my psychotic moments that something needs to be done now to pull together the voices of the clinical world, the doctors and nurses that Norbert has been talking about for the past decade, pull us all together, no matter which umbrella we're under, and say we are a movement. We together are going to stop this evil from returning to power in this country. That applies to the presidency. It also applies to Congress. And will be an entirely different country if we have a Congress of able to think about community needs and act together. And so the stakes in Congress are just as high. I'll say one final thing about Joe Biden. I don't know him personally, but I've gotten to work with many members of this administration. The defeating Trump is absolutely key. But Biden's done a good job, and he's a president with an enormous amount of skill and capability and good heart. I don't agree with everything he's doing, but there's a positive side to this too, which is that we have a guy in the Oval Office who deserves to stay there and carry on some of the enormously important work that he's done so far. Anyway, nobody should be sitting, everyone's standing and working between now and November. It's absolutely key. Thank you, Norbert, and thank you, Austin.
So hoping that people will pose questions in the chat. I'll start it off. For you, Don, you alluded to this issue of people health professionals standing together. And I'm wondering if we've got about 30 people on the Zoom now. There were 60 people that signed up. There's about 1,000 people who we communicate with on Ask Nurses and Doctors. How could we implement such more effectively than we've already done as we've prepared towards November? And for you, Austin, I'm wondering if you could talk a little bit about some of the work that you've done in Maine specifically, and what have you found to be most successful in terms of your actions and your engagements? And then hopefully we'll be also getting questions from the audience and comments from the audience.
Why don't you start, Austin, please?
I am happy to, and I think that there's really some parallels kind of between the two questions, at least from my angle of working here in Maine, in that I think a lot of the things that we've been able to do successfully have been as part of larger organizations in healthcare systems. So I work with people from the Maine Medical Association, the Maine Osteopathic Association, the Maine American Academy of Pediatrics, You know, there are separate other groups like Maine Providers Standing Up for Healthcare. And I think that, you know, being engaged inside of those places where you have these, you know, contacts of people that can kind of come together and step in when they have the time and the space or the passion, and then are willing to, you know, at least lend their support, whether it's just signing a petition, if maybe they're at a place where they are a little tapped out, whether that's a clinic schedule or something or another, are ways that you can continue to be engaged and effective without necessarily feeling like you need to kind of haul the weight the whole time. You know, I do my best to get up to Augusta whenever I can, but certainly if I have a clinical rotation that day, I'm not gonna just skip out on you know, rotation. You know, I'm on nights this week. Specifically, one was for this endeavor, but also you know, they have an extreme risk protection order that they're going to be hearing tomorrow. So I will be up in Augusta because I'm not working during the day. So I try to kind of work my schedule the way I can in order to find areas of impact. But I think it's also important to make sure that you're, again, connecting with other people. I think, as you know, as Dr. Berwick was very, you know, eloquently stating, that, you know, it's important for us to have a collaborative voice. You know, individually, I think we can have an area of impact where we can tell stories about our practice or things that affect us. Obviously in a way that's, you know, sensitive to, if we're telling a patient story, sensitive to their privacy. But you know, that is an area that not a lot of other people can speak to. You know, and I'm not a practicing clinician yet, and I still have stories that I could tell, even just in my, you know, several months on rotation. So I have no doubt that there are, you know, people on this call that could probably pull a couple hundred stories on any individual bill or policy, or to, you know, try to promote a candidate and their policies versus something else. And I think it's important that we use that platform, because it's a voice that's respected, and it's a voice that's needed across the country, and for people to be able to feel engaged. I know they even mentioned on the call last month, you know, something just as simple. I wish I had my ID badge on me. There's an organization called Vote ER. So just getting, you know, one of those scan badges, and it hangs underneath my, you know, my name tag. And if anybody asks me, it just says, are you registered to vote on the bottom? You know, I can help them get engaged with, you know, how to get registered to vote, the different policies and the politicians that are getting elected. And so I guess kind of my point on that is that, you know, the things that we've been successful in, I feel like, have been places where groups of people have come together and presented, you know, a unified front, and been able to lift, you know, each other up in the name of lifting up the patients who we serve, and that we're looking to create meaningful change for. So I think that reaching out to your networks, or if you don't really have a whole lot of networks, trying to get engaged in those networks is a really great place to start.
Thank you, Austin.
I also gave a great answer to the question you asked me, Norbert. First, let me start by saying, I don't know. I don't know how to pull us together. I know that we need to be pulled together, but it's not like an expertise of mine, but I'd sure love to know what people on this call think is possible. Here's what I notice. I get, this week alone, I'm doing 3 evening events, this being one of them, each with a group of physicians or physicians and nurses that is seeking solid ground to get engaged even further in this effort. And it happens twice a week all the time with different groups. Doctors for America, Physicians for a National Health Plan, Be a Hero, Hadi Barkan's organization, Vote ER, which is amazing what Vote ER has been doing. Movement Voter Projects, which now has a healthcare leadership component, the National Medical Association and local chapters of the NMA. There's an anti-greed organization that's been formed out of Oregon and Washington. Unionization is a friend here. There's a growing wave of physicians and nurses who are getting more active in the union movement, partly out of social conscience. I saw that Scott Hansen mentioned Dr. Michael Fine, another person convening a group, and David Choksey, formerly the head of Healthcare New York, is now forming an economics and policy group to craft proper progressive policies in healthcare. I could go on. There's a long list. How one pulls that together and say, hey, everybody, that's a movement. We're all on the same wagon, if maybe of different cars, but I don't know, but I know that it's what we need to do. I've sometimes wondered if I just got on the phone and invited everybody and said, all right, Tuesday at 10, show up, because we have to start being visible as a real strong collective. This brings me back to the Vietnam War days and the civil rights movement, when that's kind of what was going on. And it was all led by people Austin's age. So I want to be clear that youth matter a ton here.
Well,
But
let me,
maybe participants will weigh in on how to be more collective in our work.
yeah, so I'd certainly like to have people weigh in, and there've been some comments about that. Secondly, as people think about these issues, I consciously, when I started Ask Nurses and Doctors, started it as not an ORG or not-for-profit, so that we could be directly involved in elections. And that's one issue that I think can be a little bit tricky. So, so that was a very conscious decision. So within that framework, what do people think about, what Don and Austin are saying as to how we can bring, the groups together, if that's possible? What do people say? I mean, people feel free to, get off the mute. There's been some different comments. I would just welcome anybody to jump in.
I'd like to speak up. Mary
Good.
works with Research America. So there's so much at stake here. I completely agree. And I know a few of you and admire you immensely. Actually, I admire all of you without even knowing it. But we at Research, I had a nonprofit called Research America. It's all about medical progress through research, and acknowledging that cost and access are huge barriers right now, and that healthcare professionals are the best, most trusted spokespersons of all. So where I'm going on this is to say that as a private citizen, not with my nonprofit hat on, I've connected with some other people who have started a PAC, and I would never have thought I would do this, that I would get involved in a PAC and get serious about money as an influencer. So much to my surprise, actually, and this PAC is called Science Tech, it's Sci-Tech PAC. And it's not about healthcare per se, but it's certainly involved in healthcare. And much to my surprise, in less than 3 months, we've raised over $100,000 and are getting visits to key members of Congress and those who might become even more influential. Just bango, magic, bring money to the table. So what's the point of saying that? It's that, among other things, that money talks. So for people who are interested, whether you like that or not, whether it's a reality, and making contributions to candidates whom you want to see elected really matters. And backing away from that out of, I just don't like the way money works in politics is out of date, I think. And I had to talk myself into that, as well as other people. So I hope that we all assembled here today, and everybody else is taking out your checkbook as well as your time to make a difference in this election.
Thank you, Mary. And as Don said, there's a number of organizations, one of which is the Movement Voter Project, that is doing an excellent job of supporting. And what they do is they are essentially a bundler of significant amounts of money. And that I think in one of either the last election or the election before that, they raised $200 million. And what they do is they unbundle it and seed community groups who are doing the hard work of grassroots organizing. So there's definitely one theme of money, and we get that. And the question that I want to put, and I think that's important, and I totally agree with it, And Don was kind enough in one of the cycles. We did a fundraiser for one of the members of Congress, and then we did another fundraiser. So it's definitely there. The question that I would pose is how about some other ideas? There's some comments here, but I'm going to let people just raise their hands in whichever way you'd like, and I'll be happy to either call on you. I think Jeff Lerner, I just saw his hand go up, so I'm going to leave it, hand it over to Jeff. Jeff, by the way, by way of introduction, is our lead in Pennsylvania.
Thanks very much, Norbert, and everyone on this call. One of the issues you're raising is just getting the voters to vote, for the Democrats in this case. And so one of the issues is, can we get to the swing counties, places where people are persuadable? And I have two thoughts there. One is, simply writing opinion pieces in the major media in those counties. But the second idea is, what if we had the kind of connections, if anyone has them, to major press, the sort of TV press, where could we propose the idea that there be a healthcare debate between, your ideal thing would be between Biden and Trump, and it would be just on healthcare, a single issue. Now, I don't think that idea is going to happen, but the question is there a way to adapt some useful idea that gets to people, that is very healthcare specific, and so that the public can see it, can see what the differences are.
Before I turn to Art, just make a comment. It was, I believe, in the Kerry campaign, or may have been the Obama campaign. I actually don't remember, but I did both speaking engagements, and there was a couple times where there was, and I think it may have been at Jefferson, or it may not have been, Mitch Kaminsky, who I know is on the line as one of our other leads in Pennsylvania, where we had that kind of debate. But I will say, before now I'm going to turn to Art in a second, is that with respect to op-ed pieces, Morgan Moore, who is the head of reproductive rights for the Biden campaign, specifically asks for op-ed pieces in swing states or swing districts on issues pertaining to either abortion and or the cost of healthcare and access to healthcare, all the issues that Austin and Don spoke about. So certainly, after this call, when I follow up with everybody, I'm going to not only ask people to consider doing, literally, it takes no more than 10 minutes to do a video for the Biden campaign on abortion rights. And then secondly, a commitment, and we have consultants, including Dan Stone from Cedars-Sinai in LA, who's written extensively for many national newspapers, physician, to help us and help any of you on op-ed pieces. So Art, it's a pleasure to have you on. I'll turn to you.
Thank you, Norbert. And I would just add, if you could, for those of us, any information you can provide, contacts for us to figure out where would we send or where might we try to place material, because otherwise we're not going to know. And I think that would be helpful. I wanted to briefly elaborate on a comment that I put in the chat. I'm, for the moment, the only outlet that I've found that will give me a voice is Forbes.com, which does go to an interesting demographic, if you will, but it's paywall. I'm no longer having luck with the old traditional media like the Post and the Times, and so some of you probably could. New media is a bit of a challenge to me, but probably not to Austin and others. But one powerful amicus brief that I read when I did a piece, and I've never written about reproductive rights in my career, but I wrote about United States versus Idaho, which is currently one of the Supreme Court cases that'll be heard at the end of this month, regarding whether or not the Emergency Medical Treatment and Labor Act, which as an ER doc, I testified before Congress as a young man about how critically important it was that at least in an emergency department in a life-threatening situation, every American should be entitled to competent, capable, and focused care. And the Biden administration has asserted in states that are virtually banning abortion that EMTALA controls over a state law. The Fifth District Court of Appeals in Texas, of course, disagreed, and now it's going to the Supreme Court. The amicus brief that was filed included American Academy of Pediatrics, ACOG, Society of Maternal and Fetal Medicine, the American Medical Association, ACEP, the American Public Health Association, and several others. Rarely in my career have I seen across the House of Medicine and Public Health united voice. And it wasn't a legal brief. It was a brief about what this does to patients, the ethics and morality and the position of doctors who know what needs to be done and are afraid to do it. Women being sent to the parking lot and said, when you really bleed and you get really sick, come back in and we'll see you. Things of that sort. And so I think one angle here, Norbert, that we can work with and might even appeal to some of our peers that are not politically necessarily inclined to go against a historical Republican Party is, you want to talk about getting government out of between a patient and their doctor. Look what the Trump folks are doing. Look what the MAGA folks are doing. They want to legislate what doctors can talk about, what we can document, what we can counsel. We have morality clauses that allow healthcare providers to opt out of helping a pregnant woman who's seeking a termination. We don't have morality protections for doctors who want to save the life of a woman who comes in bleeding to death from an obstetrical emergency, but she's not quite sick enough yet. So that may be an angle to try to pull some people within our profession, but for patients, as Mary said, today still patients generally trust their doctors, trust their nurses. Do we want a government that's going to get into the exam room and say what your doctor can or can't say or can or can't do on behalf of you as a patient, your loved one, your child, as a possible way to draw to people who might otherwise not be immediately inclined to go along with some of the issues that we're talking about on this call? My 2 bits.
Thank you so much. And I'm looking, I'll respond and others can respond also. But what I'll say right off the bat is that it's important to have these amicus briefs. And then what's really important is to have the op-ed pieces that go into Podunk USA. And we can work with you on that. Jeff Lerner and I and several others in Pennsylvania, when the ACA was under attack, we published any number of op-eds in all these small town newspapers. And again, it's all part of a piece. And if we can work together, as Don has highlighted, then I think we can really make an impact. Don and I and others will work on creating a list of organizations for which you can donate to and organizations that we can work together. And I'm asking you, Don, I think it's a good idea for you to think about just set up a call and to have all the organizations be on the line. One of the tricky things that I still haven't figured out is the issue of working directly on elections. That's why Ask Nurses and Doctors works directly on elections and is set up that way. I've had some challenges working with other organizations because they say they can't work directly on elections, and I understand that. But that said, I think it definitely means that we need to work together and figure out a way, because any organization, an individual in an organization can write a piece, an op-ed piece, to place in a Podunk USA. I'm looking for hands of people who want to make additional comments, or you raise your hand or just speak up. This is a great conversation.
Let me just acknowledge your comment, Norbert, and Peter's suggestion of creating a list. I really want to work on that and try to get something that looks like a master list. Not everybody needs to show up. If many but not all do, that's great. If the minority do, that's still great. I wanted to ask Art a question about his reaching across the Republicans and others. as I said earlier, Art, the literature is, I mean, the survey research is pretty consistent about people being worried about their own, not about healthcare costs. That's a remote problem for most voters. They're worried about what's coming out of their wallets, and now they're alarmed. Many of them are in debt, medical debt. They're worried about access. You know, most common comment is, I can't get a doctor. And then complexity, which is, what, I don't understand this. What's this piece of paper mean? Or I don't understand my bill. So my kind of naive thought is, we have to learn to speak that language, and that's not a partisan. Those concerns are not partisan. That's everybody's feeling it right now. So I feel like we need a way to talk about the kitchen table stuff that people are feeling, even though we're policy wonks and would love to talk about the national health budget.
No, I hear you, Don. My concern is, thinking of the short finite time between now and the election, I'm not sure a lot of those folks don't blame the Biden administration, because in the last few years, they're the ones in charge, and my bills have gone up and PBMs are running wild or whatever. So I'm not saying we don't do it. I agree with you emphatically. I think there's an opportunity in the second term to do some really valuable work. Not sure there's an opportunity to pivot too much. I mean, the latest story I saw was about billions to pay more money for generic drugs, but we're not going to test the quality and safety of generic drugs. I think that's missing the point. I'm struggling with that one because I don't want to criticize the administration in the middle of an election year. But like you said, I don't agree with every decision they made, but I agree with a hell of a lot more of them than zero, which is what I saw in the prior administration. So I think it is a challenge to make that case. But like you say, where there are concrete examples of things that have been done, like half of kids out of poverty, that's a powerful message, I think. But it's not going to be an easy sell. The one-liners and the fabrications are much more appealing to people who go to their media focus to get their information.
I would say two things. And this is building on a link that Jeff Lerner actually sent me today. It featured three people. It featured Biden, Sanders, and a consumer who talked about the fact that there was that his the prices that he was paying for his inhalers and some other very expensive medication for some hematologic disorder, had come down. So what I would say, practically speaking, and if Dan Stone, who's our consultant from Cedars-Sinai, would say for sure that what's most important is to start out with a little story. And that's why, they had Sanders to start with. They had the consumer who talked a great story, and then it was Biden who sort of, cleaned it, did the cleanup hitting. I'm not a baseball fan, so I'm not sure if I'm getting the metaphor right. But the bottom line being is, I think there are enough stories out there, and I'm sure, in fact, as Austin knows and as Emily Folo knows, because I sent out an email about this today, we have a contract Ask Nurses and Doctors does to help pass legislation on medical debt. And we're looking for stories from people on the street. And it's the stories that people pay attention to. Obviously there's policy issues beneath that, but if we start with a story and then we kind of make one or 2 points, we don't want to make very many points, then that is a very successful op-ed piece or letter to that, or whichever way people want. I don't want to be talking too much, so I'm hoping that there'll be others who want to have some comments or reactions or other ways of directing the conversation. Austin?
Hey, yeah. So I wanted to add a little bit to that piece, because I think that it's important to, because I think also I was thinking about this because somebody had been talking in the chat about mobilizing younger voters. That it's important that there's acknowledgement of things that people are frustrated about. And so whether you're talking about healthcare prices or whether you're talking about some of the concerns that maybe a younger voter may have with the last 4 years is not being able to acknowledge, potentially like, where there potentially could have been more progress made or where you feel like something's fallen flat, but also being able to present different pieces of information that are not just it will be way worse, because I don't think that for some people that's super inspiring. So I think that, for example, if I was going to talk to somebody about, healthcare and healthcare prices, and, certainly something that many people in this country face, you can point to some of the positive things that this administration does in the last 4 years. Like Medicare can now negotiate drug prices, that there are meaningful steps that are, trying to be made to control the costs that consumers are seeing. And then, but not just to kind of point at successes, but also maybe give areas of impact where they can get involved. So here in Maine, there have been multiple bills that have come through this cycle where people have been, or that have addressed drug prices or coverage for certain medications, that there have been people up at the State House advocating for. So I think, getting past the, if this election goes the wrong direction, all of these things will be taken away, which I think is a very valid point, but also to, here's the things that have been being done. And also here are ways that you can get, engaged and involved right now, because I think that for some people that stagnicity of feeling like things are going in the wrong direction, that there's not really a way that they can do anything about it is really frustrating and makes people very apathetic towards kind of this system as a whole. So I think being, educated enough on things going on, whether it's nationally or locally, to try to engage people in areas where they're feeling frustrated is something that we can do to try to create a more positive conversation, and hopefully get people not just motivated to vote in this election, but also potentially get them on board with trying to motivate others to vote as well, because giving them an avenue to seeing where these avenues of impact are, I think can be really enlightening for a lot of people. And that's one of the things that I've seen a lot with some of my colleagues, is that sometimes some of the things feel very like inapproachable or difficult to access as far as politics. But I think if you give people an avenue or a runway to kind of get started on, that it can be really motivating to get younger people in the game. And I think that if you can get younger people in the game, hopefully they'll bring some of their friends along with them, and we can kind of create a good momentum in a positive direction moving towards November.
I can't agree with you more, and I want to highlight, and then hopefully there'll be other questions or comments. I actually gave this annual Archbishop Desmond Tutu talk about the work that I do separately in the Middle East, and there were about 250 students there in Springfield, and I ended up the talk by just saying exactly what Mary said, of doing something every day, whatever it is. Just doing something that's concrete, that every day of whatever sort. And then that sort of builds on itself. And so I can't agree with you more, Mary. I appreciate that comment. Other comments and questions? We don't have to stay for the whole hour, that's for sure. I want to make a couple additional comments, and certainly hope that we'll work together, Don, on this, either this call and or this list. I think this is a potentially very important outcome of this call. I want to also, I'm not sure, were you going to raise your hand, Jeff? Or was that, yes, Jeff's going to go for it.
So another action piece is trying to find out from all of us whether any of us have connections to public media, to advertising, to the things that actually sway voters. And, sometimes if you use your networking skills, it turns out somebody, either it's a professional contact or it's your cousin. But I think we actually have to have a public presence. It can't just be speaking within the profession to the profession. And, so I can imagine, to Austin's comment earlier, what is the positive? If you were in college or in your early 20s, what would you come out for? What would actually cause you to say, I want this in some public way? Is there something? I mean, abortion is obviously one of the issues that gets people on the streets. Not every issue will, but you don't have to be on the streets. You have to be motivating enough to get people to use social media and regular media. That's my thought. And maybe we could collect some of those resources if we actually thought about it, created our own catalog.
Thank you, Jeff. Eric Scherzer, it's great to have you on the Zoom and a joy to see your beautiful face. Take it away.
It's been a long time since somebody referred to me as that, but but I've been doing some work as an advisor with VOTR, and I want to call to people's attention a new thing that is been able to be implemented there, which is the EPIC system has incorporated has and now the ability to incorporate some voter registration features within EPIC. And I don't know how widely used it. Well, I know how widely used EPIC is, but I don't know how widely used those features are, or if people know about them. So those of you who are connected with major institutions that use EPIC, there could be an effort within your institution to implement those sections of it that will enable encourage voter registration. And so
Well, actually wasn't aware because our system, where I see patients, we use Cerner, and I'm not aware. It's an honor and a pleasure to acknowledge Steve Jenks. He raised his hand. So Steve, thank you so much for joining the Zoom. And I'm similar to Don. I'm a Steve Jenks fan.
Thank you, Norbert. The thing that I'm hearing very strongly is a central theme, which is that we need to get messages out. We need to use whatever form of prestige and community recognition we've got in order to get messages out. We've got to some extent to standardize the messages because there is really standardized stuff about how you put the pieces together. And if we start off with that idea that we're going to take advantage of our positions and take advantage of our ability to get a message heard and seen, then the second thing is we do have to realize that newspapers really are so passé. It's just, you may know how to get things into a newspaper, but it's not where the action is. The action is on the social media news feeds. And that's, if we can focus on that, I think we have a chance of getting more publicity than for most other ways we can go.
Thank you, Steve. I want to highlight, I think that's absolutely true. No question about it. I want to highlight Jim Nathan. Jim Nathan, who's on the Zoom, is the founder of an organization, Floridians for Democracy. And he is highlighted in the chat 2 upcoming presentations and discussions, one of which is co-sponsored with Ask Nurses and Doctors together with Scott Rifkes, who used to be Florida Surgeon General. So certainly I would encourage and ask anybody who has contacts, any of you, of course, are welcome, but we're particularly interested in working with Scott and others to organize in Florida. There's a group of about 30 or so healthcare professionals in Florida who work with Ask Nurses and Doctors and want to expand that significantly, because there's definitely an opportunity after the abortion decision that was made. It's 8:56. I'd like to see if there's any 1 or 2 last comments, and then I want to just see if Don or Austin have any final comments, and then I'll wrap it up. Any comments from anybody who wants to speak? Otherwise, I will turn to Don and Austin for any last comments. Don, you want to go first this time?
Sure, thanks. First, thanks to Austin for speaking for the kind of leadership we need in that generation, Austin, and all of you for showing up. I love what Mary Willie quoted from Porter, Congressman Porter. I mean, you got to do stuff. And so I'm going to continue to rattle cages and join groups, and we have to find each other and be working together. That's to me the agenda. So, and thanks, Norbert, for being such a catalyst as always.
Thank you. Austin?
Yeah, I would again say thank you to everybody who contributed on the call, because I knew that coming on here I was going to learn more than I was going to teach, which is the way I like it. I think the only piece that I wanted to add is, larger forms of media are obviously places where we can have large impact, and we can't lose the battle there. But I think that there's been a lot of polarization that I'm sure all of you are very familiar with people being unable to have productive conversations in areas where they feel publicly exposed, and especially if they've committed some of their thoughts and values to it. So I think about, we were able to get a speaker from Montana to come and speak to one of our groups on campus a year ago, where they had been working to get a bill voted down, that basically it was an abortion-related bill. Basically, it would have forced providers to provide any type of life-saving measures, regardless of viability of the child. It's a terrible, truly inhumane bill. And the person who came on this call, she was able to share how they were able to organize in a micro fashion. And showing up to PTA meetings with 7 people at it to say, this isn't necessarily, we may not agree on whether abortion should be legal or not, but this isn't about abortion. This is about morality. This is about humanity. And they were able to get that bill voted down by about 6%, which is still way too close. But it was a very feel-good story. And I think what I took from that was kind of that there is some importance in having some of this, in having education in a place where people feel like they can listen and not necessarily feel like they have to dig their heels in. So continuing to look for those opportunities in our own spheres, as well as looking for the larger opportunities to make impact through media, I think is we need to be engaged on all cylinders in order to really make this election, which is one of the more consequential ones that I'm sure any of us will see, a successful one. So thank you all.
Well, that was a perfect segue into the my first and my last 2 comments, which is to say that the next session which is on May 6th, with a national expert on deep canvassing, Dave Fleischer, together with Andrew Goldstein, a physician in. So Dave Fleischer is an organizer, the seasoned activist. Andrew Goldstein is as a physician in New York City. They'll be talking about deep canvassing, because don't forget, at the end of the day, we're talking about a very close election. We're talking about a small slice of voters. And one of the techniques, Steve talked about different aspects of social media. Another technique that we'll spend the whole session on next time will be on deep canvassing. So I would encourage, please spread the word. I think it'll be a very interesting session. And there's a link to the article in the New York Times about Dave Fleischer's work. And lastly, just thinking again about the talk, the Archbishop Desmond Tutu talk I gave yesterday. He wrote a book that I would definitely recommend to everybody to look at. It's with His Holiness the Dalai Lama. It's called The Book of Joy. And in the last chapter, and this actually pertains in some ways to what Mary Woolley talked about, in terms of what things that you can do every day. And one of the things that was for sure, and I spoke about it yesterday, is to do something concrete every day. And another thing which I started doing in the last few weeks, and this is my closing comment, that what is it that I express gratitude for from today? And for me today, my gratitude is to being with all of you. That gives me great joy. And I want to thank all of you today for joining. So really, thanks for being on. I'll send follow-up notes, and I'll be following up with any number of the people who are the organizers for Ask Nurses and Doctors, and look forward to working with you all. Thanks again, and have a good evening.
Thank you.
Bye-bye now.